You're reading a book or staring at a bright blue sky, and suddenly you see it, a tiny shadow, drifting, floating, moving when you try to look at it. You blink, it's still there. You rub your eyes, still there. What is that thing? Is it dangerous? Is something wrong with your eye? Or is it completely normal? Today I'm going to tell you exactly what eye floaters are, what causes them, when they're harmless, and when they are a serious warning sign you should never ignore. Stay until the end, because one of these signs could save your vision. First, let's understand what you're actually seeing. Your eye is filled with a clear, gel-like substance called the vitreous humor. Think of it like a snow globe, mostly clear, but sometimes things float inside it. As we age, this gel slowly shrinks and becomes more liquid. Tiny fibers inside start to clump together. And those clumps, they cast shadows on your retina, the light-sensitive layer at the back of your eye. That shadow is what you see as a floater. They can look like tiny black dots, cobwebs, or strings, transparent rings, or small worm-like shapes. And here's the frustrating part. When you try to look directly at them, they move away. Because they're floating inside your eye, moving with your eye movements. Eye floaters can happen to anyone, but some people are more at risk. You're more likely to get floaters if you are over the age of 50. Nearsighted, meaning you wear glasses for distance. Diabetic. Have had eye surgery or eye injuries before. Or have had inflammation inside your eye. The truth is, most people will experience floaters at some point in their life. In fact, studies show that over 70% of people will notice floaters by the time they reach their 70s. So if you have them, you are not alone. And in most cases, they are completely harmless. And this is important, sometimes floaters are your eye trying to send you a warning message. This is the part you need to pay close attention to. Floaters are usually harmless when they've been there for months or years. They move slowly and don't block your vision. There are just a few of them. They appear gradually over time. But floaters become a medical emergency when you notice warning sign number 1, a sudden shower of new floaters, not one or two, but dozens appearing all at once. This can mean your vitreous gel is pulling away from the retina, called a posterior vitreous detachment. Warning sign number 2, flashes of light. If you see flashes like lightning in your side vision, this is your retina being pulled or torn. Do not wait. See a doctor the same day. Warning sign number 3, a dark shadow or curtain in your vision. This is one of the most serious signs. It can mean your retina has already detached. A detached retina is a surgical emergency. Every hour you wait, more vision is lost. Permanently. Warning sign number 4, floaters after an eye injury. Any trauma to the eye that causes floaters must be checked immediately. If you experience any of these 4 signs, please don't go to sleep thinking it will be better tomorrow. Go to an eye emergency today. So what can be done about floaters? Honestly, most of the time, nothing needs to be done. Your brain naturally learns to ignore them over time. Many people stop noticing their floaters within weeks or months. But if floaters are severely affecting your quality of life, there are 2 treatment options. Option 1, laser vitreolysis. A laser is used to break up the floater into smaller, less noticeable pieces. It's non-invasive, quick, and done in an office, but not all floaters are suitable for this treatment. It works best for large, well-defined floaters that are away from the retina. Option 2, vitrectomy. This is a surgical procedure where the vitreous gel is removed and replaced with a clear solution. It is very effective. But like all surgeries, it carries risks such as cataract formation or retinal detachment. This is typically reserved for severe cases. My advice? Always discuss both options carefully with your eye doctor before deciding. While there's no proven way to completely eliminate floaters naturally, these habits can support your eye health. Stay hydrated. The vitreous is mostly water. Dehydration can worsen floaters. Protect your eyes from UV light. Wear sunglasses outdoors. UV damage accelerates vitreous aging. Eat antioxidant-rich foods, leafy greens, carrots, blueberries. These protect retinal cells. Reduce screen time. Eye strain doesn't cause floaters, but it makes them more noticeable. Get regular eye exams. Especially if you're over 40 or nearsighted or diabetic, early detection of any retinal problem is the best protection for your vision. Eye floaters are one of those things that look scary, but are usually harmless. The key is knowing the difference between what's normal and what's an emergency. Remember the 4 warning signs: sudden shower of floaters, flashes of light, a dark curtain in your vision, floaters after eye trauma. If you experience any of these, act fast. Your vision depends on it. Now I want to hear from you. Do you have eye floaters? How long have you had them? Drop a comment below. I read every single one. If this video helped you, please give it a thumbs up. It helps more people find this information. And subscribe to Eye Secrets, because every week I share eye health tips that could protect your vision for life. I'll see you in the next one.